Preclinical Skills 2. Rubber Cup Coronal Polishing. You will need You have 30 minutes to complete this skill. Please refer to your Preclinical Skills Manual for patient preparation. Use mouth mirror to inspect oral cavity. Visually inspect the patient's mouth for areas of stain or plaque. Select the areas that need to be polished. Select the appropriate polishing paste and PreC cup to use depending on your patient's needs. Before beginning to polish, using the rubber polishing cup, place a smear of paste over the areas to be polished. Generally, when establishing your fulcrum, try to fulcrum 1 to 2 teeth ahead or behind the tooth that is being polished. Use your ring finger to fulcrum. Sit in the 8 o'clock to 9 o'clock position. Have the patient tilt his or her head up and turn slightly away from you. Hold the dental mirror in your left hand. Use it to retract the cheek or for indirect vision of the more posterior teeth. Establish a fulcrum on the maxillary right incisors. Remain in the 8 o'clock to 9 o'clock position. Position the patient's head tipped slightly up and facing straight ahead. Make necessary adjustments by turning the patient's head slightly either toward you or away from you. Use direct vision in this area. Retract the lip with your left hand. Establish a fulcrum on the incisal edge of the adjacent teeth. Sit in the 9 o'clock position. Position the patient's head tipped upward and turned slightly toward you to improve visibility. Use the mirror to retract the cheek and for indirect vision. Rest your fulcrum finger on the buccal or occlusal surface of the same sextant. Remain in the 8 o'clock to 9 o'clock position. Have the patient turn his or her head away from you. Use direct vision in this position. Hold the mirror in your left hand and use a combination of retraction and reflecting light. Establish a fulcrum on the buccal surfaces of the maxillary left posterior teeth. Remain in the 8 o'clock to 9 o'clock position or move to the 11 to 12 o'clock position. Position the patient's head so that it is tipped slightly upward. Use the mouth mirror for indirect vision and to reflect light on the area. Establish a fulcrum on the incisal edge of the teeth adjacent to the teeth being polished. With your mirror hand, establish a fulcrum on the incisal edge as well. Remain seated in the 8 o'clock to 9 o'clock position and have the patient turn his or her head up and toward you. Hold the dental mirror in your left hand. Direct vision in this position and use of the mirror provide a view of the distal surfaces. Establish a fulcrum on the buccal or occlusal surfaces of the teeth in the sexton. Next, polish all of the occlusal surfaces. Floss the polished teeth. Give the patient a thorough rinse for the maxilla. Polish the mandibular arch next. Begin on the buccal aspect of the most posterior tooth in quadrant 3. Polish all of the buccal surfaces all of the way over to the most posterior tooth in quadrant 4. Sit in the 8 o'clock to 9 o'clock position and have the patient turn their head slightly toward you. Use the mirror to retract the cheek and for indirect vision of distal and buccal surfaces. Establish a fulcrum on the incisal surfaces of the mandibular left anterior teeth and reach back to the posterior teeth. Sit in either the 8 to 9 o'clock position or the 11 to 12 o'clock position. As necessary, instruct the patient to make adjustments in his or her head position by turning either toward or away from you and then tilting his or her head up or down. Use your left index finger to retract the lower lip. Both direct and indirect vision can be used in this area. Establish a fulcrum on the incisal edges of the teeth adjacent to the ones being polished. Sit in the 8 o'clock position. Have the patient turn his or her head slightly away from you. Use the mirror to retract tissue and reflect light. The mirror may also be used to view the distal surfaces in this area. Establish a fulcrum on the buccal or occlusal aspect of the same sextant. Alternative: fulcrum on the incisal edge of the mandibular anteriors. Remain in the 8 o'clock position. Have the patient turn his or her head slightly toward you. Retract the tongue with a mirror. Establish a fulcrum on the occlusal aspect in the same sextant. Alternative: fulcrum on the incisal edge of the mandibular anteriors. Sit in either the 8 to 9 o'clock position or the 11 to 12 o'clock position. As necessary, instruct the patient to make adjustments in his or her head position by turning either toward or away from you, or by tilting his or her head up or down. Use the mirror for indirect vision, to retract the tongue and to reflect light onto the teeth. Direct vision is often used in this area when the operator is seated in the 12 o'clock position, but indirect vision can also be helpful. Establish a fulcrum on the mandibular cuspid incisal area. Remain in the 9 o'clock position. Have the patient turn his or her head slightly away from you. For direct vision, use the mirror to retract the tongue and reflect more light to the area. Establish a fulcrum on the mandibular anterior teeth and reach back to the posterior teeth. Next, polish all of the occlusal surfaces. Floss the polished teeth. Give the patient a thorough rinse for the mandible. Follow with a full mouth rinse using air and water. Floss all of the polished teeth again.